Today we're in our Immersive Sim Suite, so this is a relatively new piece of technology that allows us to project around the walls, and we can simulate any number of different scenarios. You'll see we've got a country road here, but we can make it look like inside buildings, outside, in street. Last week we simulated a fight in a nightclub and we had 2 injured casualties, one of whom required some critical care intervention within the nightclub. So we had the sounds, we had the noise, we had lots of people milling around, and we were then able to just at the press of a button transform the scene, and we were outside the nightclub and there were people walking past, and we had a building scene. So in addition to the immersive simulation suite that allows us to project the scenes that we're at, we also have some equipment where we can mock up a patient monitor. And so you'll see the team here are able to put a blood pressure and a heart monitor, and I can then control that from an iPad here, so that we can simulate change in patients' physiology and their condition, and that adds to realism for the team, so they can react to those changes in a patient's condition in a way that they might with a real patient. This iPad gives us lots of different parameters that I can change here, so I can make the patient's heart rate go up and press the button there, and very slowly that will gradually increase on their monitor, and so they'll notice that change and start to think, why is the patient's heart rate going up? They might change their medication that they're going to give the patient. They might need to administer some blood product because we carry blood and fresh frozen plasma on the helicopter. So it's absolutely crucial that we train together as a team. We have the pre-hospital emergency physician and the critical care paramedic making up the team on the air ambulance or on the critical care car. Some of the incidents that we attend are the most unwell and badly injured patients in our area. And so some of the interventions that we have to carry out are very high stakes, and allowing us to train in this safe simulated situation means that when we do have to carry out those procedures, we're well rehearsed, well drilled and safe. The key as well is about teamwork and the team working together, the doctor and the critical care paramedic, and practicing closely allows them to work most effectively as a team out when they're seeing patients.